Hello, my name is Brenda. I'll be your physician assistant student. Today I'm going to perform an abdominal and MSK exam. If you can go ahead and take off your shirt, shoes, socks, and empty your bladder at this time. I'm going to go ahead and wash my hands. Alright, now I'm going to have you go ahead and lie down over here. I'm going to have you bend your knees. I'm going to make sure the xiphoid process to the symphysis pubis is exposed. I am now going to inspect the contour of the abdomen for scars, striae, masses, distension, pulsations, and the condition of the umbilicus. I'm now going to go ahead and auscultate in all 4 quadrants, making note of the bowel sounds. If I don't initially hear any bowel sounds, I will listen to all 4 quadrants for 1 full minute. I'm going to make note of the sounds I hear. I heard normal active bowel sounds. I am now going to percuss in all 4 quadrants for tympany and dullness. I'm also going to percuss for splenic enlargement along the lowest intercostal space, along the anterior axillary line. Alright, now I'm going to go ahead and palpate the 4 quadrants. Are you in any pain before we begin? No. If the patient were in pain, I would have them point to the area that is causing them pain, and I would palpate that area last. I'm now going to start off by palpating 1 centimeter deep for any superficial masses and any distress. I'm going to make sure I look at the patient's face for any signs of distress. Alright, I am now going to palpate deeper 4 centimeters in the same 4 quadrants for any deep masses or distress. I am now going to palpate for liver enlargement, masses, and tenderness. I'm going to have you go ahead and take a deep breath in. Alright, breathe out. I'm now going to palpate for splenic enlargement, masses, and tenderness. Go ahead and take a deep breath in. Alright, breathe normally. I'm now going to have you sit up. And I'm going to assess for CDA tenderness bilaterally. And at this time, I will perform a rectal exam. I am now going to move on to the MSK exam. I am first going to inspect and palpate for symmetry, signs of inflammation, edema, effusions, deformities, malalignment of bones, tenderness, muscle atrophy, we've got abnormal movements, crepitus, condition of the surrounding tissues, and ease of range of motion. I'm now going to inspect the posture anteriorly and posteriorly. as well as inspect the shoulder and pelvis for alignment. I'm going to inspect the lateral aspect for lordotic or kyphotic curvatures. I'm now going to inspect the scapula, the spinous process, the paravertebral muscles, and the sacrum. I am now going to palpate the scapula and trapezius, the spinous process, the paravertebral muscles, the sacrum, and the SI joint. I'm now going to have you stand up. I'm going to assess the range of motion of the C-spine. So first we have flexion, go ahead and look down. We have extension, look up. We have rotation, left and right. We have lateral bending, placing your ear to your shoulder on both sides. I'm now going to assess the range of motion of the thorax and lumbar spine. I'm going to place my hands on your hips. I'm going to have you go ahead and bend down for flexion and come on up and bend backwards for extension. I'm now going to have you rotate your body without moving your hips, so to the left and right. And now I'm going to have you lateral bend, placing your hand on your thigh and moving your hand down your thigh, left and right. I am now going to assess the TMJ. I am going to have you open and close your mouth. Move your jaw left to right and back and forth for protraction and retraction. Now I'm going to have you go ahead and take a seat. I am going to inspect the upper extremities. I am inspecting the clavicle, scapula, the AC joint, the proximal humerus, the biceps and triceps, the antecubital fossa, the olecranon. You've got the ulnar and radial styloids, the carpal bones, the interphalangeal joints. I'm now going to go ahead and palpate. So we first got the clavicle, the scapula, the AC joint. We've got the biceps tendon and groove. The medial and lateral epicondyles, the olecranon. I'm now going to palpate the forearms, the radial and ulnar styloids, the carpal bones, the MCP joints, the anatomical snuff box, and the interphalangeal joints. Now I'm going to assess the range of motion. If you can go ahead and stand up. So first we got shoulder range of motion. Go ahead and place your hands above your head. We've got shoulder flexion. We've got shoulder extension. We've got abduction, adduction, external rotation, internal rotation, circumduction. Now we're going to move to the elbows. So we've got elbow flexion, elbow extension, we've got pronation and supination. Now we're going to go ahead and do the wrist. We've got wrist flexion, wrist extension. I'm going to have you go ahead and ulnar deviate your hands, your wrists, and radial deviate the other way. All right. Now we're going to go ahead and move on to the fingers. So I'm going to have you flex your thumb and your fingers, extend your fingers, abduct your fingers, adduct your fingers, extend your thumb, abduct your thumb, adduct your thumb, and thumb opposition. All right. Now I'm going to have you go ahead and take a seat. I am going to first inspect the lower extremities. So we've got the hip, the SI joint, the greater trochanters. So I'm going to have you go ahead and lie down. So hip, ASIS, greater trochanter. We've got the lower extremity, the calves, the patella, the patellar tendon, tibial tuberosities, medial and lateral femoral condyles. We've got the interphalangeal joints, the metatarsals. And now I'm going to go ahead and palpate those areas. So we've got the hip, the ASIS, the greater trochanter. We've got I'm going to palpate the leg as well as the calves. I am now going to palpate the medial and lateral femoral condyles. I'm going to palpate the patella. We've got the patellar tendon, tibial tuberosities, the Achilles tendon, medial and lateral malleoli, metatarsals. I'm going to move to the metatarsals, as well as the interphalangeal joints. And at this time, I'm going to go ahead and sanitize my hands. I'm now going to assess for range of motion. So we've got hip and knee flexion. We've got knee extension. We've got internal rotation, external rotation, abduction, adduction. I'm going to have you turn away from me, lying on your side. We've got hip extension. All right. Now I'm going to go ahead and perform that on your other leg. So we've got hip and knee flexion, knee extension, internal rotation, external rotation, abduction, adduction. I'm going to have you turn away from me again. We got hip extension. All right. Go ahead and lie back down. I'm now going to assess the range of motion on the feet and ankles. So now I'm going to have you plantar flex or dorsiflex. We've got plantar flex. I'm going to stabilize ankle. We've got ankle inversion and eversion. Inversion, eversion. I'm now going to stabilize the MCP joint and have you flex your toes down and extend your toes up on both sides. All right, and I'm going to go sanitize my hands again. I am now going to measure the calves. So if you can go ahead and bend this knee. I'm going to measure the calf in the widest area. We've got 13.5 inches. I am going to make note of where I measured and then measure from there. Got 6 inches. Head and this leg up until go ahead and note 13.5 inches. I am now going to measure the range of motion of the knee. So if you want to go ahead and place this leg down and move your foot as close as possible. I'm going to use a goniometer to measure the range of motion. Right. We've got 145 on the side. I'm going to move over and measure the other side. Right. Got 145 on this side. And that concludes your MSK and abdomen exam. Thank you so much for being my patient.